Good evening. I'm Dr. Nishakar Tiwari, working as a consultant physician in Navjeevan Nursing Home. So today we'll discuss about gastritis. First, we'll know what is gastritis. Gastritis is the inflammation of stomach lining, can affect people of all ages. And as we know that there is lining, many layers in stomach. The uppermost layer is mucosa. Mucosa which protects the stomach from acid involvement and as we know that there is two factor in our stomach, which is one protecting factor and one protecting factor, and which increases the chances of gastritis. Like first factor, we can understand that there is mucosal lining which protects from the HCl, and with the increased gastritis. So the risk factors are alcohol and smoking, using NSAIDs and sedentary lifestyle. Some infections are also in risk factor like H. pylori infections. We can diagnose it by looking the symptoms. Symptoms are like atypical symptoms. Like older adults with gastritis may not exhibit the characteristic symptoms. Heartburn, heartburn is the classic system. Might be absent or mistaken for a other age-related condition. Comorbidities like multiple health condition in older adults can make it difficult to pinpoint the cause of abdominal discomfort. We can do endoscopy. Endoscopy is the gold standard diagnosis for the gastritis. It can be more difficult to tolerate in older adults with underlying health issues. Management will minimize the risk factor, like reducing the use of NSAIDs and other medications like anti-cancers, corticosteroids, using like establish and eradicating the underlying cause. If there is H. pylori infection, we'll have to treat that H. pylori infection, and dietary modification, a bland diet, avoiding spicy and acidic food, and using pumping inhibitor. These medications are often used to reduce the stomach acid production and promote healing. However, their long-term use in older adults requires careful monitoring for the uh, potential side effects. So, like gastritis is the common condition among older adults, posing like unique challenge to diagnose and management. Understanding the age-related changes in digestive system along with the tailored approach, counting of comorbidities and medication use are crucial for effective management and improving the quality of life in older adults with gastritis. So we will understand there is two type of generally gastritis according to etiology and the cause. So like there is acute gastritis and chronic gastritis. In acute, it comes using NSAIDs, stress induced, and some alcohol using and smoking. And in chronic, there is two type of chronic gastritis. First, type A and type B. Type A is generally autoimmune, and type B is like infections with H. pylori infections, Helicobacter pylori infection. Type A, which is autoimmune, it means that our own antibodies act on our body, which increases the chances of gastritis. And other is Helicobacter pylori, which is come under type B. Okay, so the we can there's the prevalence of gastritis which increases with the age, and this can be attributed for several factors like thinner stomach lining, and also there can be if there is ischemia in our gastric mucosa, which also increases the chances of gastritis. So one more factor which protect our gastric mucosa, which is prostaglandins. Prostaglandins, what prostaglandins do is which increases the which vessel dilate the gastric blood vessels. So which the blood flow in the gastric mucosa is good, which protect from the HCl, which damage the gastric mucosa. Other thing is okay. Another factors which is as I told, mesenteric ischemia, which is same thing like blood flow of the mucosa, sedentary lifestyle. Gastritis also happens in some geographical area like where more spicy foods are used. In management, for we have to for dietary modification. Yes, we have to avoid the spicy food and we can't use regularly like NSAIDs and like medications and steroids. We will see the symptoms of gastritis, which is like burning pain in the upper abdomen and lower chest, belching, nausea, and vomiting, a loss of appetite, hiccups, and weight loss. And in treatment, we will see that a gastroscopy, where a long thin tube with a tiny camera is passed down the esophagus, which is food pipe, into the stomach. A small tissue sample may be taken for the further testing. Breath test for H. pylori will test for H. pylori bacteria, and for in gastritis, we'll do what we will do in home care, which is like we'll have to take the medication as directed, which is antibiotic, and then we'll have to finish the courses of antibiotic. Avoid the aspirin and anti-inflammatory medications like ibuprofen because they make the gastritis worsen, and avoid the food which that upset the stomach, such as spicy and fatty foods, and we'll have to limit the using use of alcohol, smoking, and coffee, and for like medicine, we'll have to use like antacids, which can neutralize the stomach acid that causes the constipation, diarrhea, and may reduce the absorption of some medications. Proton pump inhibitor (PPIs) are the group of medication which can help to treat the ulcers or gastritis by reducing the stomach acid production. PPIs can be taken over the counter or by prescription. PPI can help with the range of peptic ulcer condition, including non-bleeding peptic ulcer. Like PPI can help prevent the peptic ulcer and reduce the risk of complications like bleeding peptic ulcers. And PPI work can also help with other upper GI disorders such as GRD, GERD like diseases, Barrett esophagus, and eosinophilic esophagitis.